Hello, this is Jonathan Kay reporting virtually from Massachusetts on day 2 of EULAR 2022, which is being held in Copenhagen. This meeting has been very successful with over 9,000 participants in attendance. At the abstract session this morning on clinical aspects and comorbidities of rheumatoid arthritis, there were several interesting presentations about a variety of topics. Over the past several years, there's been great interest in interstitial lung disease as one of the most frequent extra-articular manifestations of rheumatoid arthritis that significantly increases the risk of mortality. In abstract OP0132, Jose Andres Romani Vora of the Hospital Universitario La Fe in Valencia, Spain, presented data about the prevalence of rheumatoid arthritis-associated interstitial lung disease in Spain. He and his colleagues used natural language processing to analyze unstructured clinical data obtained from over 2 million medical records at 6 public hospitals in 4 different communities in Spain. They found the prevalence of rheumatoid arthritis to be 0.5%, which is comparable to that in 2 previous studies conducted in Spain. However, since data were obtained only from public hospitals, this could represent an underestimate of the prevalence of rheumatoid arthritis. Among over 11,000 patients with rheumatoid arthritis, they found the prevalence of interstitial lung disease to be 8.6%, with 2/3 of patients being female, a mean age of 67 years, and 2/3 of patients reporting cigarette smoking. In contrast, the prevalence of cigarette smoking among rheumatoid arthritis patients without interstitial lung disease was 54%, which is consistent with the causative association between cigarette smoking and rheumatoid arthritis. This prevalence of interstitial lung disease is higher than that of 1.7% and 3.7% in 2 earlier studies in which medical records were reviewed manually. When comparing the prevalence of comorbidities among rheumatoid arthritis patients with and without interstitial lung disease, this group found the prevalence of infections, malignancies, and kidney and heart failure to be higher among rheumatoid arthritis patients with interstitial lung disease. This study took advantage of natural language processing to screen medical records from a very large number of patients to identify the prevalence of interstitial lung disease in rheumatoid arthritis. However, since chest radiographs were not performed in all patients, this study relied upon the clinical diagnosis of interstitial lung disease. Although the use of natural language processing might have been more sensitive to detect cases of interstitial lung disease, this higher prevalence of interstitial lung disease might also be due to greater awareness of this comorbidity of rheumatoid arthritis in recent years. It will be interesting to see this study replicated in other geographic locations with different patient populations. With publication of the oral surveillance study earlier this year in the New England Journal of Medicine, there has been great interest in the risk of malignancy and of major cardiovascular events among patients with rheumatoid arthritis who are treated with targeted synthetic or biologic DMARDs. In that study, incidence rates for major adverse cardiovascular events and malignancies were each higher for rheumatoid arthritis patients who are older than 50 years treated with tofacitinib than for those treated with TNF inhibitors. In abstract OP0135, Yvette Meissner presented real-world observational data from the German rabbit registry regarding the risk of cardiovascular events in patients with rheumatoid arthritis treated with JAK inhibitors. They followed patients who initiated treatment in 2017 or later with JAK inhibitors, TNF inhibitors, or conventional synthetic DMARDs. They identified a subgroup of these patients who were 50 years or older with at least one cardiovascular risk factor to correspond to those enrolled in the oral surveillance study. They found comparable incidence rates of major adverse cardiovascular events in patients receiving JAK inhibitors or those receiving TNF inhibitors. The incidence rate of major adverse cardiovascular events in the rabbit registry was lower than that reported for tofacitinib in both the oral surveillance trial and the STAR-RA study, which looked at patients in a Medicare claims database in the United States. The authors concluded that there is no evidence of an increased relative risk of major adverse cardiovascular events with JAK inhibitors compared to TNF inhibitors when used in daily clinical care. In abstract OP0138, Juan Molina Colada of the Hospital General Universitario Gregorio Marañón in Madrid presented data from the Spanish Biobazador registry regarding the risk of cancer after biologic and targeted synthetic DMARDs in 352 patients with rheumatic diseases and a history of prior malignancy. They found the rate of incident cancer per 1,000 patient years to be 38.3 for patients treated with TNF inhibitors and 21.8 for those treated with JAK inhibitors. The risk of incident cancer in patients with rheumatic diseases and a prior malignancy did not differ, regardless of the type of biologic or targeted synthetic DMARD to which they were exposed. The investigators could not differentiate between new cancers and recurrent cancers. These results suggest that the incidence of recurrent malignancies is not higher in rheumatoid arthritis patients treated in daily clinical care with JAK inhibitors compared to those treated with TNF inhibitors, but these data need to be confirmed in other registries. I have mentioned 3 abstracts which report the prevalence of interstitial lung disease, cardiovascular events, and recurrent malignancies in patients with rheumatoid arthritis using various methodologies. However, there have been many other interesting abstracts which I do not have time to discuss in this video. For more information about these and other presentations at EULAR 2022, go to rheumnow.com. I'm Jonathan Kay. I'll see you tomorrow.